Welcome to the Eye of the Needle podcast, where we discuss healthcare innovation and explore how visionary entrepreneurs and change leaders are reshaping the future of our industry.
Hello, this is Pam Arlotto, host of the Eye of the Needle podcast. We're here in Nashville, Tennessee at ViVE 2025. This episode will be recorded from one of the exhibit booths. We're going to be meeting with the CEO of Elligint Health, Chris Caramanico. He will talk about his company, the changes he's seen over a long career in value-based care and population health, and some of the things that will be happening in the future. So let's go to Chris and our conversation now.
So Chris, can you tell us about the company? Give us a little history. Give us also a little bit of where you guys are today and kind of your future vision, where you're going in the future.
Sure. Thanks, Pam, and thanks for having me, and thanks for stopping by the booth. Super excited about what we're building at Elligint. When we looked at the marketplace, we looked and said there needs to be a tool set horizontally across serving value-based care from a payer perspective to a provider perspective, and it needs to be a common framework and a common tool set. And when we saw point solutions, and so what we did was we took a top-notch value-based care analytics platform in Health EC, and we married that to a top-performing care management, utilization management, disease management platform in virtual health, and the Helios platform. And we believe that as we continue to extend that infrastructure, we can now empower different settings of care, but we could do it with one common data set and one common perspective. So super excited about it. And, we're 60 days in and really bullish on where we're going and what we're doing.
When you first got into value-based care, say 10 years ago, you were with a different company. And can you talk for a minute about how the population health platform and value-based care platform environment is different today than what it was when you first started in this space?
Sure. Yeah, no, sure. It's completely different. I mean, when we first started looking at value-based care models, everything was retrospective, right? So what happened, why did it happen, and what the heck could we do about it? Whereas now we're flipping to what I'll call 2.0, and we're saying, we better figure out what's going to happen, when it's going to happen, to whom it's going to happen. And now the more complex part is get that data to the right care provider so they can intervene at the right level. So it's a complete transformation. But, Pam, I would suggest that it's no different than other industries that have had to transform their delivery models and use technology and use business process reengineering to do the same thing. Right. And I think we're on a journey, and I think you have to start somewhere, and you start with retrospective analysis of what's going on. And then I think now you're going to go to prospective, and then with the advent of AI, I think now it's going to be finding the needles in the haystack.
And predicting the future and guiding the future. I
Right.
guess that's what I hear you saying. Well, you were just presented at a session on value-based care, and someone in that session mentioned that part of the challenges we've had over the last 10 or so years is that we had the fee-for-service chassis, and that we tried to hook population health and value-based care onto that. What is different today than, say, with some of the practices and ACOs and others that you're working with in terms of recognizing they can't just do business as usual with fee-for-service?
Yeah, so I think it matters on the practice and their level of sophistication and the amount of value-based care that's penetrating. So if you find a practice that has 10 or 12% of their population that's value-based care, I think what you're going to find is somebody that's looking for innovation. If somebody's still in the 2 to 3% range, they're still living off the fee-for-service chassis, and I think that's a great analogy. And so it's very difficult for them to kind of throw out the chassis that's getting them there and try to re-innovate. If you extend that out and we start to look at areas of opportunity as CMS pushes more and more value-based care arrangements across the pike, the more prospective physician groups are now starting to say, okay, this is coming. How do we reimagine the practice? How do we remanage the administration of care to better work in this environment? And more importantly, what data do I need to get? Where do I need to get that data so that I'm able to do that?
Well, several years ago, we know that Medicare said they wanted to get all of their customers on a value-based care environment 100% by 2030. Do you still think that's a realistic goal? And do you see that happening?
Well, I think with the current administration, I think their goal is to try to find cost management solutions. And so clearly value-based care is a cost management solution. So my guess is they're gonna accelerate the movement towards more effective and more cost-effective care. And when I say that, I also think that there are certain things that this administration needs to do to enable that.
Mm-hmm.
The flow of data, number one. This timeliness of the flow of data, number two. All need to come in part to make that happen.
Right. That makes sense. So given all of that, you've mentioned not having 100% of your patient population in a value-based care contract or some type of arrangement. Other type of challenges or barriers are kind of top of mind today.
Yeah. So I think the one that I hear all the time for the folks that are performing well in a value-based care arrangement is they're getting increased pressure to move to a two-sided risk arrangement. And in that two-sided risk arrangement, while there's good upside, there's also significantly increased downside. And I think that becomes the biggest struggle for some of these physicians who don't have the financial wherewithal to manage that two-sided risk. So I think that's the biggest challenge.
And redesign the care model, because you can't use the existing fee-for-service care model in that two-sided scenario. Is that fair?
Yeah. I mean, I think if you're currently successful in the plan, I think it's more about emotional risk than it is about actual business risk. We've got a client in central part of the United States, and they've been the top 10% performing value-based care group for a number of years. So they're clearly doing all the right things, or many of the right things they need to be doing. The challenge is, as they get moved into, in an MSSP world, an enhanced model, what they're getting forced is a doubling of the downside risk. And that makes these independent physicians absolutely nervous.
Yes.
And so if we're going to promote the higher upside, we need to have some way of helping secure them a little bit on the downside, especially because we've got empirical evidence to show they know how to perform.
So I know early on in that last 10-year period, a lot of the care management platforms and solutions were sold to single enterprises. But now we're moving more and more toward an ecosystem environment or a community environment where different organizations have to collaborate with other providers or ACOs or whatever. And are you guys, are many of your customers in that environment where they're kind of having to look kind of at that whole patient, not just what they're doing for the patient?
Yeah, completely agree, Pam. I think this is one of the big challenges, and this is where I see regulations being able to assist.
Mm-hmm.
The challenge becomes, let's just take a potential scenario. I'm in a value-based care arrangement. I visit my primary care physician, and they want me to see a pulmonologist. So they send me off to the pulmonologist. The pulmonologist doesn't understand, first, the value-based care arrangement I'm in. Second, what previous work has been done. And then they don't have an instant feedback loop to get that data back to the primary care doc so they can report on the work that was done. So that closed loop referral is super, super important to perform at your top of your license in this value-based care arrangement, because not every PCP can deal with all the episodic issues that we need them to.
And you need to be able to share data across those sites and the analysis, the analytics associated with both what happened and what's going to happen, as you mentioned earlier.
So think about it this way: if in a perfect world, back in the early 1900s, you would have a doc pick up a phone and call the other doc and say, hey, listen, I'm sending you a patient, and here's what's going on with the patient. I want you to look for this. I want you to look for that. And I'd love to get some feedback on what's happening. And then that patient would show up and the physician would look at the patient and they would pick up the phone and call back and say, I looked at your patient and here's what I found. Well, we've got to be able to use technology to close that information loop.
So I know you guys have had some experience with specialty care and value-based agreements for oncology, behavioral health. Can you talk a little bit about how that's going to be different in this 2.0 world you described?
Wow. Yes. So the biggest challenge that we see there is oncology's been doing value-based care for a few years. Primary care and value-based care models, as we talked about earlier, have been out for a number of years. So people have gotten used to it. They've refined business processes. And so oncology is just in the early stages of adopting this value-based care. We see that with the CMS's EOM or enhancing oncology model that they're putting forth. And so teaching the oncology physicians to better utilize that data and use it at the point of care is going to become super important.
Mhm.
And so I think that's where some of these models that haven't been in a value-based care arrangement are now starting to get educated. Behavioral health's the same way. As we know, for years, behavioral health and clinical care was always separated, right? If you were in the hospital and you were on a psych ward,
Right.
your chart was locked and people could look at your medical data, but they couldn't look at your psychiatric data. Now with that coming together, now we're starting to figure out that patient and those challenges are interlaced, and we ought to be treating the whole patient as opposed to just treating a symptom of what is a whole patient issue.
So I get how a lot of this is working with large organizations and enterprises. You've got, big ACOs, you've got big practices or health systems, you've got but what about those small practices, the smaller ACOs, the smaller payers, or the smaller community organizations? Where does Elligint fit in with those guys?
That's why we created Elligint Health. There is not a set of tools and infrastructure for the independent physician, value-based care practices, for regional payers who don't have the size and the scale that some of the larger players do. And they're outmuscled and outgunned every single day. And they're in a battle where their technology is a liability to them performing at the top of their capabilities. And so we think that we'd like to level the playing field. And we think that Elligint Health's tools spread across those regional payers and across those independent provider organizations who live in a heterogeneous computing world can get that data brought together and presented to them with our platform.
And I understand that Elligint has a really interesting name, and it makes sense given that the group you want to focus on. Tell us where Elligint comes from.
So Elligint is the merger of elegance and intelligence, right? So it's not so much to be smart, but you have to be elegant in the way you portray that and the way you put that smart to work. So at Elligint Health, we feel like we could smartly help you put data to work, put the tools together to work, and better perform for your patients and for your plan.
In an elegant and seamless, frictionless environment, making it easier on them to do those things that
Absolutely.
they couldn't do without you. That makes a lot of sense, Chris. So you and I've talked a lot about what the basics of a care management platform are. There's the tie to EHRs as the foundational system. There's that interoperability layer, an analytics layer, care management, and then a patient engagement layer. How do you, and that's been that way for a number of years, and
Right.
a number of the companies that are providing these tools, they have those components. What's going to be different today, looking over the next 5 to 7 years? You mentioned AI earlier. Any other components that you see that are going to be part of those platforms that we maybe haven't had historically?
Yeah, so I think I think it's point solutions in a population health value-based world are tough to scale, right? Because it's the gaps in the data, right? When we were in the inpatient setting, we used to call it patient handoffs, right? Safe patient handoffs. How do I get transition one care provider to the next care provider, right? It's the same thing on the value-based care side. How do I make sure that I'm handing that data off from an analysis group to an intervention group to a patient activation group? And how do I do that seamlessly without the bumps in the road? That's the challenge that we're trying to conquer at Elligint Health. That's the work that our team does every day.
Makes a lot of sense. Well, we're looking around this exhibit floor here at ViVE, and this meeting, I think this is its 4th year in existence. It didn't, first one was in Miami about 4 years ago, and it's growing. Lots of big names that we recognize, lots of names we don't, new companies. What is your take on ViVE and compared to a number of the other conferences that we're all familiar with, like HIMSS and other things that we've been to for
Sure.
years? What is different about this show?
So I think the number one thing that sets this show apart is you're blending payers, providers, and vendors and companies together. So if you look at the attendee list, you have self-insured employers that are coming here to look for solutions for their employees. You have TPAs, you have healthcare regional payers, national payers, you have provider groups, you have health systems. So this is the ecosystem we need to attack. Every other show is focused in one subsegment of healthcare, which is incredibly important. But if we're trying to solve the $1 trillion healthcare challenge across, we need everybody at the table with us. This show brings everybody to the table.
And one impression I have is they all are here to innovate. They want to meet up. They want to have a conversation. They're just not here to sell their product. They're here to meet all the other people to figure out how we can work together to really innovate and redesign this new future for our industry.
Yeah, I mean, when I first got into the industry, right, the common theme was if healthcare gets to be more than 20% of GDP, we're in trouble as a country. Well, we've passed the 20%. We're still okay, but I think now people are starting to really lean in, and we're starting to look at what are we spending, how are we spending it, how do we have to innovate? Just like the banking system had to innovate, just like the travel world had to innovate, healthcare is going to have to do the same thing. It's a complex business, it's complex data sets, but that's where technology comes in. And that's when you get smart people from all perspectives, employers, payers, providers around the table. That's when you create that innovation.
It's something new and different and not just the same old, same old.
100%.
So I always have one question that I end my conversations on this podcast with, and I never tell the guests. I want to surprise them a little bit. But what's the one thing that we haven't talked about today that is on your mind day in and day out that you think you'd like to share with our audience? What's that one thing we haven't talked about today?
So I'll twist it a little bit. So I think the question I'll look at it is, what's the one thing that keeps me up at night?
Yeah, that's fair.
Can we lead our clients where they need to go? Can we do it fast enough so that we can continue to build our clients' profitable businesses, right? And I think that's the challenge in any innovation, right? Can you apply the innovation at a rate of change that's consumable, but also profitable, right?
Well, and that's perfect ending for this podcast because we're called the eye of the needle because the change is so difficult. It's like going through that eye of a needle.
Absolutely.
And that is what we're all facing day in and day out.
Absolutely.
Well, thanks so much,
Absolutely.
Chris.
Absolutely.
I appreciate it.
My pleasure.
I've enjoyed
Thanks,
it.
Pam. All righty.